This is the NG Tube skills video. I'm going to check the orders to ensure the healthcare provider has put the orders in for this patient. I'm going to gather my supplies, the NG tube, my gloves, hand hygiene. I have a cup of water for my patient to drink with a straw, some water-soluble jelly, tape, tissues, safety pin and rubber band. I have an absorbent pad, a basin with pre-cut tape, and a pH labeling pH strip to monitor and check how much the pH is. I have a syringe with the tip attached, as well as a pen light. So I'm going to then go into my patient's room, going to introduce myself while I'm doing hand hygiene and putting gloves on. I'm going to verify that this is the correct patient with name and date of birth. Going to explain the procedure to the patient. I'm going to then place the head of the bed in a high Fowler's position. If the patient can tolerate that, then I'm going to close the curtain to provide safety, comfort, and privacy for my patient. Before inserting the tube into the patient's nose, I'm going to check the patient's nose to ensure that there is no skin breakdown, no deformities, no sores, and observe to see which nostril I can place the tubing into. So we're gonna go with the right nostril because it has greater airflow. Then I'm going to prepare the tubing by placing the tubing into a warm basin of water that's going to allow the tubing to be easier to insert into the patient's nose. I am then, first I will put this over the patient's body. I will measure the tubing to ensure that I know how far to insert it. So I will measure from the nose to the ear, and then from the nose to the xiphoid process, which is then going to be about 55. So I will take my marker and I will mark it on there as to how far I will be putting the tubing in. I will then take some lubricating jelly and put it on the end of the tubing to help it go easier into the nose. I am then going to take the curved portion of the tubing and begin to place it in the patient's nose, advancing to the nasopharynx. I'm going to keep directing the tubing back along the side of the nostril towards the ear. Once the tubing meets some resistance, then if the tubing meets some resistance, then I would need to pull it out, lubricate it more, and give the patient a minute to relax, and hopefully they don't have any nausea or like start retching or throwing up. Once the tubing gets to a little bit of to the point, I'm going to ask the patient to hyperextend their neck, so that way I could then advance the tubing more, about 5 to 10 centimeters, while drinking from a cup of water with a straw to advance the tubing. Every sip, it's going to be 5 to 10 centimeters. Then I'm going to keep going each sip. And we get to about this spot, and when it gets to the spot, we're going to have the patient take a couple of breaths, and I will then tape the tubing down and just to ensure that it stays in place. We're gonna ask for a chest x-ray if that's the procedure or policy for the place that we're at for the patient. Then we will aspirate to ensure that the tubing is in the correct spot. And we'll then use our pH strip to check and make sure that it's between 3.5 to 5 to ensure that it is in the stomach. As long as, while we're waiting for the chest x-ray, we are going to then secure the tubing to the nose. And take a safety pin to then secure it to the patient's gown. We'll then return the bed to the lowest position for safety, and then ensure that the x-ray does show that it's in the correct position. Once it's in the correct position, I'm going to then attach the tubing to the suction or the feeding, whichever is appropriate for the patient. Then I'm going to verbalize how the NG tube will be cared for after placement. If it's to suction, then we're going to monitor what comes out of the NG tube and document that, like the characteristics and the drainage of how much. Then after all of that has been done, I'm going to remove my gloves, perform hand hygiene, make sure that the patient is comfortable, and I will then go to the chart and document the procedure and what care I provided, as well as document any findings and have already cleaned up my mess.